Welcome to this podcast on nested melanoma. Nested melanoma is a newly recognized entity that has been recently described. Using genomic hybridization, this tumor showed multiple genomic aberrations that has been also found in superficial spreading melanoma, outlining that nested melanoma is just a variant of this subtype. Nested melanoma usually arises in middle-aged patients, and clinically it's a flat lesion with a brachial thickness less than 1 mm. But let's take a look to the clinical and morphologic view. Here we have a patient with this outlier lesion located on her right upper back, and looking closer we see that the lesion is greater than 7 mm in its largest diameter. Dermoscopically, nested melanoma is typified by the presence of this CLOD or globular pattern that shows the presence of multiple globules that vary for colors and distribution throughout the lesion. Confocal microscopy reveals the presence of a regular CLOD pattern at a higher magnification that mirrors this proliferation of large intraepidermal nests as seen in histopathology. Looking closer at the higher magnification, we can detect on confocal microscopy the presence of atypical melanocytes within the nests, highlighted here by the arrows, that mirrors also the histopathological counterpart. Here we see another example. This is a very flat patch on the leg of an elderly woman that is ABCD positive. And again, dermoscopically, we see the same repetitive monotonous pattern with the globular pattern. Here we observe the presence of globules that shows multiple colors ranging from light brown to dark brown and even to black colors with this asymmetric distribution throughout the entire lesion. And confocal microscopy in this case highlights the presence of focal pagetoid cells in the upper epidermis and the presence of some atypical neoplastic melanocytes at the dermoepidermal junction. Again, another example revealing an ABCD positive lesion from a clinical point of view, and dermoscopically the presence of the so-called CLOD or globular pattern that show asymmetry and the presence of multiple colored globules. Now let's consider 3 rules to recognize this spatial variant of superficial spreading melanoma. First of all, we have to remember that epidemiologically, NEVUS pattern in the elderly is typified by the presence of intradermal persistent nevi and other non-melanocytic tumors such as seborrheic keratosis or solar lenticus. So when we have the presence of a flat lesions in the elderly, we should raise our index of suspicion for melanoma diagnosis. As a second rule, we have to consider that nested melanoma usually reveal a large size. That means growing lesion, but we know well that a growing lesion is not acceptable in elderly. And as a third rule, when we look to the dermoscopic view of this tumor, we see the presence of multiple colors and this irregular distribution of globules that are synonymous for melanoma diagnosis. And thank you for your attention.